opioid fellows in that conversation. So will Senator Wilson and Representative Mizuno come on up and talk to us a little bit about their experience as opioid policy fellows. So Senator Wilson.
Sure. It's a little nervous now with Kate in the back. And being an opioids policy fellows, it was a great honor and privilege to be part of that cohort, the initial cohort for that fellows program. And we looked at a lot of different policies and different programs around the country and what's going on. And in our state, more than 50% of our out-of-home placements are due to drug or opioid related offenses, substance abuse issues. And so we took a deep dive into some of our policies of how to help curb that, what is driving this new initiative, sort of the after effects of the opioids. We have a lot of, one of these things that we came up with, or was a fact, was that a lot of families are being removed, and just families are just being destroyed because of our opioid crisis in our country. And so we looked at ways to, went back to my state, looked at ways in our communities of how we can address this and how we can do this, because it's just not a substance abuse issue, it's just not a child welfare, early education issues. They're all sort of combined together. And we looked at looking at FIT courts, or what we say babies courts, and that's modeled after the 0 to 3 court. And I know some states have them, Arkansas, California, Connecticut, Florida, Louisiana, Mississippi, Nebraska, Oklahoma, and Texas. And so we just started one in my community in the Matsu Valley. And it's focused upon 0 to 3 ages, and the way that the courts, and we have a health foundation who is help funding this initiative, and we're looking at basically providing those families all additional resources. So it took a lot of legislative push for our child welfare agency to accept that funding from their health foundation, so they're funding a position to work with the court and to help. Basically just all they're doing is that child welfare position is working with the court, and they also funded a court position to help coordinate sort of the China cases, the child in need and aid cases, to work with this families and infants and toddlers court. And we looked at other different policies to help ensure that these courts had everything they needed to be successful. We passed a couple of major pieces of legislation. One was House Bill 159 that was mandatory for the prescription database monitoring programs, and that's very controversial in some states, but we sort of pushed it through fast enough so our lobbyists didn't really have time to, to interfere with that. But with the PDMP implementation, we already saw 11% decrease in this first year of type of opioid prescriptions that were being given out. It gives annual report cards to pharmacists and physicians to see where they are with the current to the peers or their outliers. We had our ERs all come together for our drug seekers, and they are all our ERs promise to always give the least restrictive option in terms of pain medication. We gave a standing order for our chief medical officer to allow for naloxone treatment to be given out. So anyone can have that life-saving drugs for the Narcan. We have kits given out. It's called Project Hope in our state. We did the 7-day limit supply for opioids. We have a non-opioid directive. So if you are a recovering addict and you choose not to have that, you can have that in your medical record that, let's say, that you do not want to prescribe opioids, because a lot of folks just don't understand when you go in for pain or medications or surgeries that is a habit forming. So the education of that piece is very important. And the education also of our child welfare workers, because I worked in a program that we used, Seeking Safety. It was a women's residential action program that helped families reunify. And the hardest part is that relapse is part of recovery, and it's really hard for our child welfare agencies to understand sort of the addicts and how they go through that. There's a lot of education with that. And we allowed our AG to help prosecute some of the new synthetic drugs that are coming out, and that's just ratified after, so they're allowed to do those bans, and then it's ratified by legislative action next session. And the major piece of the child welfare bill that we just passed was a House Bill 151, which makes our child welfare agency increase the visitation and kinship research, It allows foster parents to have a little bit more autonomy to make those decisions. It requires sibling contact. We reduce the client caseload and training for workers. We did the 5-year sort of retention and recruitment plan so that they have to make sure that they have something in writing of how they're going to address these issues. And it allows sort of the NGOs to have that first contact with families. So a lot of times families may be screened in to services, but they may be screened out to services, but it allows them to give their names with the parent permission to allow them to contact them so they can get those additional resources and help and intervention. And that was huge. That was one of the amendments that I made sure that was in there in this piece of legislation after attending the opioids policy fellows to make sure that other agencies be able to have contact with these families.
Can I ask you a question? Was the 5-year recruitment and retention plan for case managers or foster families?
It's for the It's for the child welfare agency. Sorry, the sort of nonprofits. Non-governmental. Yeah. And so with that, we did a lot of work and working with some of the other states and some of the other fellows in the programs, and it's just amazing to see what's going on in other states. And we always say, Alaska's so special. My colleagues say, we're such a vast state, but really coming to sort of these fellows programs, we understand that we're not alone in dealing with these issues. And having such agencies as NCSL to help us and help us do the research and policies was really informative and really helpful in terms of guiding some of our legislation going through and working with my peers and colleagues, understanding a little bit more and going in depth and so forth.
Thank you so much. Thanks. I wanted to thank Nina because she did a great job at setting this up, and the entire NCSL team. How about a round of applause for them? I hope you don't mind. I'm not going to stand up because if I do, I might start to break dance. So I'm going to just chill here. And that's a plug for Nina. Yeah. I love you, Regina. Nina was great. Going back on June 19th, we did an informational briefing on child welfare services. And we had her kick us off. It was a conference call. Don't worry, next time we'll have you come in person to Hawaii.
Yeah. I told everybody on the phone. I didn't go to Hawaii.
I asked Nina, and you're 5 hours ahead of Hawaii, so thank you for being a trooper. We had her. We had the senior family court judge Remigio there. We had the director of human services there. Of course, our legislature. So the 3 branches: HGA, the union, and the nonprofit. So it was amazing. And foster kids were there. I can email you the info briefing notice as well as the press release that we did at the end. We had 6 points of action. A lot of that was powered forward by Nina. So I wanted to thank her for that briefing and let you all know that she is a great resource. So invite her. Going back and taking a deep dive.
Invite her in person.
In person. How do they cover the charges? Legislative purpose. And I see Kate in the back, and so yes, I am a little nervous.
Oh, no.
She was our leader for the opioid policy fellows meeting kicked off in New Orleans in January. During session for us. It was a great break for myself and Senator Baker, and along with Senator Wilson and our colleagues. Folks, I'm going to give you a big picture, and I'm going to pull us back into how this relates to child welfare, families and children, and substance abuse. Members, in 1960s, heroin devastated our people. It hit the U.S. and it was a crushing blow to our people. It just devastated our people. Back in the 1980s and 1990s, crack cocaine hurt our inner cities. Exploded upon the scene. Crack cocaine, powder cocaine really was a gut punch to America. We're beginning to see a pattern. In the early 2000s, crystal meth wiped out cities. You all know about the meth labs throughout our nation. And Hawaii, because we're non-contiguous, like Rep. Wilson and I, we're not part of the contiguous U.S. Alaska and Hawaii was devastated per capita. We were really hit hard by the crystal meth epidemic. And now we come to 2010, and we see the opioid epidemic. And the scary thing about this, we see a pattern here, and according to CDC in 2016, 64,000 Americans died of a drug overdose. That's the highest. That is a scary fact, dubious fact for our people in the United States. Now what's the one commonality that we see when we talk about heroin and cocaine, and I didn't mention it, but alcohol, crystal meth, opioids, and a number of other drugs that I haven't even mentioned? The one commonality is addiction. So as we joined as opioid fellows, and I hope the next class, many of you will be part of that, because Senator Wilson and I had a great time. We learned so much, and it was awesome, just like this class was, because there was no one-upmanship. Everyone was working with each other to better their state. It was a beautiful thing. The one commonality is addiction. And so if we, opioids now, fentanyl is now going to be the next killer, severe killer. 10 years from now, there's going to be another drug. It's a pattern, and we know it. So when we met as fellows, we talked about the big picture. We need a systematic change on addiction. And it's not only on opioids, it's on everything. Because as Kate was there and we're talking to our experts, when we put the lowdown on suppressing opioid addiction, guess what? Heroin goes up, crystal meth goes up, alcohol goes up, abuses of other drugs will go up. So we need to have a collaborative front when dealing with addiction. Here's the focus. When you talk about rehab, 6 months or even a year of rehab, that's great. If the state will pay that, if the Family First Act works on prevention and will pay that, that's great. 6 weeks, 6 months, a year, I'm going to tell you folks, it's not enough. Once you have an addiction, it's a lifetime. It's a lifetime. We heard a wonderful speaker, I won't mention her name. She was addicted and she got out of her addiction, and now she's a motivational speaker. She was at our last conference for the Health and Human Services Chair. She did a great job. Rehab needs to be a lifetime commitment. And this relates to child welfare services in our families that might be afflicted with addiction. We need a strong support system. So when you're talking about families, children with their parents or foster parents, or their regular parents that unfortunately got addicted to something, you also need a strong support group, be it AA, family, church, your DHS worker, your nonprofits. You need that support system, and you need to continue it for a lifetime. And once you're able to beat your addiction, it's always going to be there in the back of your mind. So you need to know later on you'll be a mentor to someone else, but you can always backslide. Addiction is a major concern. Once we get that mom or dad stable and we allow them to heal, we need to have them build self-confidence. After that, we need to help them be examples to mentor others. So intervention services for children and for families and children that are dealing with substance abuse is important, but that's just the start. That's day one. This is going to be a lifetime. And again, if they can be successful, and I'm a realist, you're not going to save everyone, but if you can save that mom or dad or that family that has a substance abuse problem, they're going to be a prime example, shining example, and this will carry on. And I've heard Representative Ray yesterday did a great job from Utah talk about Vivitrol and how it helps deaden your craving for drugs. Invega does the same. That's only one aspect. Again, it needs a whole systemic change in your lifestyle. You need to stay with that support system and stay real. For our state, Senate Bill 2646 is electronic prescription accountability system. Simple. It's monitoring the other doctors. So just say Senator Wilson and I hypothetically are doctors, and all of a sudden they're looking at the chart, and Regina, they see Mizuno is prescribing 80% more opioids than Senator Wilson, Dr. Wilson, and all the other doctors. So it's meant not really to vilify me, but to call me out. So we're not subject to penalty under the Federal Uniform Controlled Substance Act, but we're given a warning, and our medical board can provide professional discipline. So that was one of the bills we passed because of the opioid fellows policy group. Thanks, Kate, and Senator Wilson and our team. Last year we established a 7-day limit with exceptions. Say I get a hip surgery and I need oxycodone for 10 days. The doctor will explain why, and I can probably get it for 10 days. You'd think this would be simple. House Bill 1602 opioid warning label. And by the way, we're blue state, and the person that introduced this was a Republican, and she passed it, which hardly ever happens, we know that. I can even read how simple it was. It says, caution, opioid, risk of overdose and addiction. Duh. But you know, we, believe it or not, in conference, we got an earful from Department of Commerce and Consumer Affairs saying that we're going to charge the pharmacist a Class C felony if he does something. And Baker and I were just livid. We're like, where were you? We're going through the bill hearings throughout the entire session, and we're on conference. We've got 2 days left, and you're telling us this. We did a fix. We did a quick fix, and we passed it. It was a minor change. But anyways, some of the fun that we have in conference. Senate Bill 2247, we followed Senator Wilson, the opioid antagonist. This is naloxone. This is for if you have a person that is possibly addicted to opioids, not only does that person, but your family member or caregiver can go to the pharmacist and get that antagonist to rehabilitate the person that ODs. So this was very important. And again, we pretty much followed Senator Wilson in Alaska, what they did. We copycat their law. I mean, it's real simple. Why reinvent the wheel? And Senate Bill 2407 allows medical cannabis to be used to treat opioid abuse or withdrawal symptoms. Unfortunately, the governor vetoed it. We're not coming back for an override, so the bill is dead. But if you want to look it up, Senate Bill 2407. And the last point I wanted to make, and I wanted to thank Kate and my colleague, Senator Wilson, all of you here. Kate and the NCSL team on the opioid policy fellows did a great job. In fact, we even got our own web page, my understanding. So if you all are interested in looking up what some of the measures were, simply turn to it as a resource. And with that said, I just want to thank all of you. It's been an honor. We've learned so much from each other. We're less than 25, very select group, but thank you again for sharing your knowledge and allowing us to become better lawmakers. Thank you.
I also just forgot to mention, you know, the FIT court that we have, our Families, Infants, and Toddlers court, the data shows that it's 3 times faster that children reach permanency, and the also data shows that within 2 years, 99% of the kids that were involved do not have a reoccurrence of child maltreatment. And so with that, I just want to ensure that those states, you guys look into it, look at ways that you can probably use some of the new funding coming out to help fund these things. And one of the most important things I got out of the policy programs is that, you know, we always look at best practice, best practice, best practice, but sometimes we just need to look at some of the promising practices that may not have the years of institutional data and research, and just look at promising factors. And then, of course, my favorite quote from that is that, you know, common sense is not a flower that grows in everyone's garden.
And I would tell everyone that at our next meeting in November, we're going to have a component on these infant toddler courts.
All right, we have time for 2 very short questions from the contiguous United States.
Common sense is not a flower that grows in everyone's garden.
So, yeah, we don't grow flowers here, we grow weeds. It's a special flower. So here's my question. I don't know if it's for you guys or for friends of Mathematica, but the thing that I'm struggling with is I don't want to miss the forest through the trees. So the big question for me, and this is what I've been trying to figure out in my state, is when does substance use, misuse, abuse, or dependence equal child maltreatment? Because you could have somebody who's, you know, got a mental health disorder, has schizophrenia, safe parent, right? As long as the things are in place to address the schizophrenia. Doesn't mean that there aren't issues that come up, but it doesn't mean that child welfare needs to be involved. At the same time, you know, I hear anecdotal cases of parents that are smoking marijuana in front of their kids, and all of a sudden there's, you know, an action from child welfare. Whereas if they were smoking a cigarette, which is arguably as risky, or drinking alcohol, they might not have. So when does substance use, misuse, dependence equal child maltreatment, so we can actually right-size the responses?
So in our state, we asked the same question when marijuana became legal and other substances. It's when the child obviously is in danger, harm, neglect. And so if you're obviously having a DUI under the influence, or your substance abuse aids to the neglect of that child or harm to that child in some way, then that's when those things are researched and checked out in our state.
Yeah, Representative Singer is an expert in this area. He's a caseworker, so this is in his wheelhouse. Absolutely, when there's any signs that there might be abuse to that child, an ounce of prevention can save a life. And again, Representative, I've taken your law, the task force. That was one of our 6 points that we did at our info briefing. But yeah, you're a caseworker, you know this. And so once we see there's a possibility for abuse, we'd rather monitor that and avoid that than deal with the fatality at the end of the day. So good question. Thank you.
I'm just going to piggyback from a national perspective. I think that was a great example from their 2 states. So one of the other projects that I work on for the Administration for Children and Families at the federal level is developing a database. We just finished a pilot, so it's going to be a little bit until we finish this, but we're documenting how states differ in their definitions and policies about what constitutes child maltreatment and how there are different reporting, screening, and investigation policies and follow-up. So my answer to that question is, having done some of this scanning already across states, it's completely dependent upon the definition, the statutory definition the state has about what constitutes child maltreatment, abuse, or neglect in that state, whether that is an infliction of some sort of injury or harm or risk thereof, and how that is statutorily defined in a particular state. And so that you just have to look very closely at, one, what's the kind of legal threshold for it, as well as then how does the agency put that into practice and then screen for that. And that will completely vary from one state to another. So an example that you gave, they may have been screened in for using marijuana in front of their child, and that might have been a report and screened in another state, that may not have been the case.
All right, we've gone way, way, way over time, so we'll do one more quick question, and then they're going to be around. I think Elizabeth and Deborah are going to be able to hang out for the rest of the day, and we'll have some more action planning where you can talk to them, and of course, if you want to get connected to anybody, just let me know.
Actually, I'm just going to make a follow-up comment, so it's going to take one of my questions, but unpacking what in Minnesota, we had a huge fight over that substantial maltreatment and all that, but the reason I want to bring this up is because the conversations we got into is not whether or not you witness opioid abuse, or whether you're in the car with someone that's intoxicated, chronic inebriation, but domestic violence, pornography, all of these factors, and then the question comes up, okay, you saw mom and dad do it, but what if you see it on TV? What if you see it through entertainment? And so where does it stop? So to your point, and the 50 states, that is a Pandora's box if there ever is.
I was just gonna, it was a quick comment, and it was just it was kind of what we were talking a little bit about yesterday, like the use versus abuse kind of situation, and then also the consistency within the state. Because not only is there states, they judge what, maltreatment, but so does judges, so does DHS workers, so do attorneys. I know in Iowa, and just in our county, your case can, that same situation that you talked about can be completely treated differently depending on your judge, the GL on that case, and I see it all the time. And we literally develop plans that are correlated to who's on that case, and that's when I think we're trying to satisfy professionals instead of trying to satisfy what the family actually needs.
Everyone promise 10 more seconds, and then I swear to you, and I'll stop.
I promise you just 10 seconds, but I would like to know if anybody else is dealing with female genital mutilation in this, because we had a huge fight in that, and I would love to talk to anybody that's going down that road.
We actually just outlawed it in New Hampshire.
Did you have it interact with the child?
I believe it is considered a form of abuse.
Okay.
So that's one of the things we're documenting in the project I'm on. So we're asking that in every state, what state has policies on it. We don't have data on it.